that what was in many ways, I guess, a reality check to Canadians, saying there are other countries that are going to get these vaccines before us. If countries produce vaccines, vaccines will arrive in those countries before Canada. I think it surprised a lot of people who had perhaps not considered the specifics of how all of this was going to work. It certainly caused consternation amongst some premiers. Yesterday we heard Saskatchewan Premier Scott Moe and Ontario Premier Doug Ford questioning whether or not Canada was going to be, as they were putting it, at the back of the line when it comes to vaccine distribution. Now, we also had a briefing from federal officials and nonpartisan officials, we should say, civil servants, talking a bit about the timeline rollout around all of this. One official from Health Canada saying it's likely, if everything goes according to plan, and Rosemary, of course, we have to put a huge asterisk around all of this. We still have to wait for those Health Canada approvals. They are not a sure thing, but that it's likely that at least one vaccine, Pfizer seems to be the leading candidate, could get approved in December. We could start seeing vaccines in this country in January. The premiers did have a call last night to talk to the federal government, the Prime Minister, Minister Dominic LeBlanc, about this as well. I talked to Premier Blaine Higgs of New Brunswick afterwards. He said he went into the call with some concerns. He did feel ultimately it was a good news call. He got answers to some of his questions, but he did say not answers to all of his questions. There is more precise information that the provinces are still looking for right now in terms of precisely how much vaccine is coming, at what time, where is it coming to, so that they can work out the distribution plan. He suggested that information is coming to the provinces in December. He did express a lot of optimism about this. He said certainly by the second half of next year, they'll really be ramping up. They'll be in a position to vaccinate a lot of Canadians, but there are still some outstanding questions.
Yeah, and that call, David, I know you did some reporting on it as well. It was not an aggressive call. No one was yelling at each other. It was really to try and get information, and that may be frustrating to premiers to not have all their questions answered, but it may also be just the way this is going to unfold.
Yeah, my understanding is Alberta Premier Jason Kenney and Ontario's Doug Ford were perhaps the most persistent in asking questions, hoping for specific answers. But to give people a sense of why you can't know you're going to get this many doses by this date is simply because one, these vaccines are not approved yet, though we do expect approval on or around the 10th of December. And then the contract for Pfizer and Moderna is to deliver about 6 million doses by the end of March. Now, you could get a call from Pfizer saying, we are ready to deliver 500,000 doses on January 3rd. And then 2 weeks later, here's another 50,000 doses. Oh, and then here's 1 million. So it's going to come as manufacturing scales and as other contractual obligations are met. So this is why there's an inability to be completely precise on doses and delivery dates, simply because it is entirely dependent on Pfizer's capacity and Moderna's capacity, once approved, to deliver these things. And then there's the ability to receive it here on the Canadian end. The government's reaching out now to buy a bunch of fridges. It's got contracts for about 126 fridges. It's received about 3 dozen or so already, because the Pfizer vaccine needs to be kept at -70, -80. So until you get the fridges and get the fridges deployed and in strategic spots, you can't really say where the Pfizer vaccine is going to go. And also, Pfizer is not going to deliver this vaccine until Canada says, we have the capacity, here it is, let's go. And so there are all of these challenges that need to be sorted out as we are at the end of November, with a vaccine approval expected in 2 to 3 weeks, and then delivery several weeks after that. So the briefing yesterday was a good first start. I think we can all agree, and we're going to get one a week outlining all of this. But something Catherine and I have been talking about is we can get a sense of what the issues are and the logistics are because we have access to senior officials in government, and we can talk to them on background and they can explain it to us. The elected arm of this government needs to do a better job walking the country through what the complications are in perhaps more precise detail, because it's not just the premiers, it's 30-odd million Canadians who want to know when this is coming, and then to have confidence that it's going to be done properly and fairly once it starts, and the right people are getting the right needles at the right time.
Yeah, and these weekly briefings, you're right, will go some way to illuminating us all better on the timelines and how this is going to unfold. I will say, after yesterday's, I did feel a little bit reassured, because it did sound like, at least in terms of the approval process, we are working, in lockstep with the United States and with the UK, and so we won't be delayed on approving the vaccines as they come in. It is all the other complicating factors you're talking about. For instance, I didn't realize yesterday we need an enormous amount of dry ice to keep all these things cold, which I should have thought of, I guess. But it is an incredibly complex logistical challenge here. And I know this morning some people are reporting that a former general who headed up one of our NATO missions is going to take over some of that. We're expecting to hear from the defense minister. Maybe the prime minister will mention it too again this morning. It also comes at a time where, of course, we've been talking about this week different provinces at different places. Ontario's cases today are a very alarming number, 1,855 new cases in this province. One would hope that that is a one-off, Catherine, but when you see those kinds of numbers, it does make you anxious for a vaccine. It makes you anxious for information and to know, how this is going to move forward.
And I think I feel like we start to lose track, Rosemary, as people who are keeping an eye on the national picture of how many times we're saying record-breaking cases. It's important to note not only those 1,855 record-breaking cases in Ontario, but 20 deaths that go along with that. Quebec, 1,269 cases, 38 deaths that the province has announced today. And I think it does point to this interim period as we talk about the hope that vaccines bring and the scale-up effort that needs to go on around that, because as more and more vaccines get approved, Canada expects to have access to more and more vaccines. There is months of an interim period. And of course, we're incredibly concerned across the country, I think all Canadians, about seeing people who are particularly vulnerable getting access to those vaccines first. That is, of course, the plan. People who live in long-term care centers, where we saw the majority of the deaths, particularly in the first wave. But there are serious questions and a need for serious reflection about what happens before we start seeing those vaccines roll out and before we see a larger percentage of the population being vaccinated. So people do need to reflect on their own behavior. There is also important reflection, I think, from officials at all levels of government about the supports that are in place to help Canadians get through this time. There's been a lot of talk. I mean, it's Black Friday today about how small businesses in areas that are locked down are coping, whether or not they have sufficient support. Appeals from governments in different parts of the country asking Canadians, if you are going to be making those Black Friday purchases, perhaps you can think about local businesses, small businesses that need your help. But, there is hope. I spoke to one expert yesterday, Dr. Alan Bernstein, who is actually part of the committee that's advising the government. And he said, when you think about the progress we've made on vaccines and where we are on all of this, really is a moment for celebration in a lot of ways. It is also, though, I think, a moment for a lot of still consternation, concern, reflection when we look at not just the provinces, territories as well, obviously what's happening in Nunavut, a source of great concern. And we know that we're creeping up on the Christmas holidays. We see different provinces approaching that in different ways. Quebec, obviously a bit of an outlier, saying that they are going to permit these small gatherings, they think, but as the numbers continue to be troubling, not necessarily the case. So a lot of factors that need to be balanced, considered by both the federal government, various orders of government, provinces and cities, and all of us, frankly, to think about our own behavior as well.
I'm going to go a little bit weedy here into some of the distribution questions, David. There have been recommendations, obviously, about who gets vaccinated first, frontline workers, vulnerable people, that kind of stuff that would be, agreed upon by everyone. But there was a conversation by provinces last night around the notion of per capita distribution, which I understand wasn't resolved. But maybe you can help us understand a bit better what that's about and why there is such concern from provinces around that.
Yeah, they're still kind of sorting out exactly how it's going to go, but like the way these things work on the Thursdays when the premiers meet with the prime minister is they have a pre-meeting where they get together and sort of talk about their priorities, and then they meet as a group with the prime minister. And there's a consistency at the premier's table that the global vaccine that comes in gets distributed to the provinces on a per capita basis. Now, the triage that is being recommended by the vaccine experts would still apply. So, Ontario with about 40% of the population gets 40% of the vaccine. Then they would start with vulnerable and high-risk populations, frontline healthcare workers and essential workers, and work through that before moving on to the next tier in sort of the vaccine hierarchy. In terms of making sure that we get the most vulnerable people protected first. The issue with this, and where there's been some conversation, is that different populations have different provinces have different population profiles. So I'll use my home province, Newfoundland and Labrador, much older than Ontario, much more comorbidities, a lot more vulnerable populations just in the broader population. Do you make the argument that they get a little bit extra to deal with that because of their population profile? Or do you make the argument that Manitoba and Alberta get some extra beyond per capita because of the state of the pandemic there and how that's a cauldron compared to the rest of the country? Then there's the Indigenous populations in Canada, often remote, often without housing for isolation, and considered to be extremely high risk. How do you handle that? So there's a lot of complexities in this. So there seems to be that the approach preferred by the premiers, as multiple sources have told us, is that it's strict per capita and let them take care of their own populations. There's not, the federal level, there's maybe some disagreement with that may not be the most efficient way, because to get really into it, one vaccine might work well with seniors and another vaccine might work well with people my age in our 40s, you know? And it's how things are most effective and how the dosage applies and what the storage capacity is in various provinces. And then you spill out from there, Rosie, is if Pfizer needs to be stored at -75, Moderna at about -20, do you have that capacity in remote northern communities, in isolated rural communities? Do you bring the vaccine to people? Do you bring people to the vaccine? So this is a sort of military-style operation that needs to be considered in terms of building a logistical supply chain, which is why we expect that we're going to have this, as been reported by some of our colleagues, a former top general or major general is going to be spearheading this at the national level. We've seen Rick Hillier has been drafted by Ontario to spearhead their vaccine effort on a provincial level. So there's quite a lot of questions, quite detailed, that you wouldn't ordinarily consider, because we can't do a normal vaccine rollout like we did with H1N1 or do with influenza, because we can't gather in groups because of the way this thing spreads. So this is going to take a long time. Like, even if the entire vaccine supply arrived tomorrow, we have no capacity to deliver it quickly. It's going to take a long time.
Well, and as you point out, that wouldn't be a smart idea given the way this virus spreads. Yeah, we actually probably are better suited to have it spread out over time and make decisions about who's going to get it as production ramps up, because that was the other piece that they said yesterday. Of course, you know, you'll get your first batch of doses and then the company will come back and say, well, now we can produce it at this capacity. And
others will come online and more vaccines will become approved. And hopefully we get a curve that's exponential, but a positive curve that's exponential, as opposed to the ones we've been dealing with all year.
Yeah, I will. Yes, go ahead, Catherine.
I was going to add, Rosemary, speaking yesterday again to Dr. Alan Bernstein, one of the doctors who's advising the federal government on issues around vaccination. He did say that one of his sources of concern, something that he'd like to hear more about all levels of government from, are the details of the kinds of plans that David was just talking about. And he said he thinks it's important that sort of information start to become public, also so that it's clear to the vaccine developers that Canada is ready. And he did say, you know, there is a world where, and we've touched on this, the complexity of scaling up, like particularly the Pfizer and Moderna vaccines are really new technology, high tech. They don't know how the scale up is going to go. And that's part of the reason I'm told by health officials that it's been so difficult to predict what kind of quantities we're going to get, right? Because this essentially just hasn't been done before. But as that scale up happens and companies have to make decisions about where to send the limited quantities of vaccine that are available, it needs to be clear that Canada, and that doesn't just mean the federal government, of course it means the provinces and territories too, are prepared to receive this. And obviously the temperature aspect of those two vaccines, a very important part of that. I will say he wasn't sounding an alarm, let's say, but he was saying it's something that he'd certainly like to see more of.
Thank you, Catherine. All right, you're now the Prime Minister of Canada. We'll talk to both of you after he's finished speaking.
Bonjour à tous. Today, Ontario released their highest number of daily COVID-19 cases ever. This week, Alberta saw their biggest cases ever, too. People on the East Coast are facing new cases and travel restrictions. And across the country, hundreds more families are grieving the loss of someone they loved. We're in some of the toughest days of this pandemic. Winter is coming. We're being driven indoors. We can't sit on patios and terraces like we used to. We're going to have to hold on tight. We're going to have to be there for each other by keeping our distances from each other. Avoid gatherings, follow local public health rules, and know that we're going to get through this winter. Vaccines are on the horizon. There's a light at the end of the tunnel. But we need to do what we can right now to make it through these coming months. Hier soir,
Last night, I held my 22nd virtual meeting with the premiers of the provinces and territories to discuss the common efforts we are making. During our meeting, we spoke of our response to COVID-19, namely the measures we're taking to support businesses and people who are facing targeted closures, as well as support to hard-hit communities and our vaccination plan. I will first talk about our response to COVID-19. Our government has already provided more than $25 billion to the provinces and territories, namely to help them improve ventilation in schools and to purchase PPE.
We've shipped hundreds of millions of pieces of PPE, over 5.2 million rapid tests, with more to come, and invested over $25 billion to help the provinces and territories fight COVID-19. We expect that this support gets to people and communities, because that's who it's for, and that's where it makes a difference. Just look at what federal funding through the Safe Restart Agreement has meant to folks in Portage-la-Prairie, Manitoba. The city used part of their funding to help business owners who are having troubles with property costs. It made a big difference for local employers and their employees during a really difficult time. Businesses, cities, and provincial governments are facing tough choices about public health measures. Our government is here to help. In fact, this is something the premiers and I discussed during our First Minister's meeting yesterday. Already, our government has provided additional targeted support to communities facing significant outbreaks, and we're ready to do more as needed. As I discussed with Premier Savikatak earlier this week, our government is providing over $19.3 million in additional emergency support for Nunavut. This will go towards everything from more PPE and healthcare staff to getting healthy food on people's plates.
Lastly, the premiers and I talked about vaccination. Together, the federal government, the provinces, and the territories have been working on this since the month of May. We know that we must establish a joint plan if we want to offer a safe and effective vaccine to Canadians as quickly as possible. Given that we're receiving more and more promising news about vaccine candidates, we're accelerating this work. During our meeting, Minister Leblanc gave more details about our plan. As our experts explained yesterday, we are expecting to obtain millions of doses of vaccine against COVID-19 early next year, with doses for all Canadians during the course of the year. We will be working with the provinces and territories and with Indigenous communities to determine how we're going to distribute these doses. And we are going to ensure that we follow the advice of the experts of our various advisory groups that are made up of the very best scientists in the field in this country. All of our decisions are guided by the recommendations of the best experts and scientists.
Canada is well prepared for large-scale rollouts of vaccines, but this will be the biggest immunization in the history of the country. We must reach everyone who wants a vaccine, no matter where they live. Right now, we're working closely with the provinces and territories as well as Indigenous communities to ensure readiness to receive and distribute these vaccines. To assist in this process, we are standing up a National Operations Centre through the Public Health Agency of Canada with the support of the Canadian Armed Forces to coordinate logistics and distribution of vaccines. Major General Danny Fortin will be heading up the logistics and operations within this centre. Major General Fortin is a seasoned officer, the Chief of Staff of Canadian Joint Operations Command, and served as commander of NATO mission in Iraq. The Canadian Armed Forces will assist on planning, including to meet challenges like cold storage requirements, data sharing, and reaching Indigenous and rural communities. For our part, the federal government has already purchased freezers to work for specific vaccine candidates. This will be a major effort, but together, Canada can and will do this. In our meeting, The Premier spoke about the need to work in partnership with the federal government. They also brought up the fact that in certain cases they will need support to ensure that everyone is reached, including vulnerable people and Indigenous people. When a vaccine is ready, Canada will be ready. We're in this together, and the more we work as a team, the better we'll do. So to everyone, to all Canadians, continue to wear a mask, keep your distance, and wash your hands. Avoid large gatherings. And don't forget about one of the easiest ways to join the Team Canada effort by downloading the COVID Alert app. Over 5.5 million people are now using the app, and just yesterday, the Northwest Territories was the latest to bring COVID Alert fully on board. No matter where you live, even if you're in the North or the Atlantic where cases are fairly low, download COVID Alert. This is literally a tool in your pocket to fight this virus. Aux jeunes.
To our young people, if you haven't yet done so, download the COVID Alert on your phone. And if your parents or your grandparents are having difficulty downloading it, give them a hand, like you often do, helping them to unmute their Zoom. We can all contribute to ensuring the safety of those around us.
Young people across the country. I have a teenager and a preteen at home, and I can tell you they're always on their devices. Young people need to download the COVID Alert app. It's a way of helping your parents, your grandparents. It's a way of making sure that you're doing your part, hassle-free, to protect yourself and your community from COVID-19. It'll take a second to download. It's free. It protects your privacy, and it helps concretely in combating this virus. So please, do your part. Download the app and help your parents and grandparents download it as well. We're over 25% uptake in terms of available smartphones, but we can do even better than that. As we look towards the coming months, we need to use all the tools we have, and COVID Alert is yet another tool in our toolbox. This morning, I also want to speak about something else we're doing to keep people safe and set everyone up for success. This coming January will mark a year since Bill C-92 came into effect to affirm the rights of First Nation, Inuit, and Métis Nation communities to exercise jurisdiction over their children and families. This co-developed legislation is about putting kids first, having fewer children in care, and reuniting more families. To do that, Indigenous communities must be in the driver's seat. Since January, we've worked with partners to move forward on the reforms needed to child and family services. And today, we're taking the next step in this process. Our government is investing $542 million to Indigenous communities to exercise full jurisdiction over child and family services. This is vital to moving forward on our promise to address the unacceptable injustices that too many kids and families have faced in the care system.
Today, I can announce that our government will be investing $542 million in Indigenous communities to help them exercise their full jurisdiction over family and child services. This investment is on top of the more than $3 billion that we've already invested in order to offer predictable, flexible, and long-term funding aimed at ensuring the delivery and modernization of care services for families and children. Our government will continue to work in partnership with Aboriginal communities in order to fill the existing gaps and to move forward on the road to reconciliation. In conclusion, I wish to underscore that we are now less than a month away from the holiday season. I know that December will be difficult for a lot of people, but don't forget that the present situation isn't permanent. There is light at the end of the tunnel. In the meantime, we must hold on a little longer. Those working in our hospitals, in long-term health care facilities, in schools and grocery stores need our help to ensure their safety. Their families are counting on us to help them ensure the safety of their mother, their brother, or their daughter. So follow your local public health guidelines, wear your mask, wash your hands, keep your distance, and avoid gatherings. Download the COVID Alert app, and don't forget that you aren't alone.
Or a business owner, you don't have to face this crisis alone. If you need support while you look for work, we've introduced the Canada Recovery Benefit and enhanced EI. If you need to take care of a family member or stay home from work because you're sick, we've created the Canada Recovery Caregiving Benefit and the Canada Recovery Sickness Benefit. If you own a small business, we've launched new support on rent, expanded the Canada Emergency Business Account loans, and extended the wage subsidy. On Monday, we'll be releasing our fall economic statement. We'll have more to say then about what else we're doing to support you through this pandemic and rebuild a strong, resilient economy for everyone. But for now, I want you to know that we're here for you, for today, for tomorrow, for as long as we need to get through this. We have your back. Merci.
Thank you, Prime Minister. Merci, Monsieur le Premier ministre. On va commencer la conférence aujourd'hui avec le téléphone. Opérateur, c'est à vous.
Merci. Première question, Émilie Bergeron.
First question, Émilie Bergeron. Yes. Good morning, Mr. Trudeau. In English, you stated that we're expecting that the support we provide will reach people. What were you referring to? Are you thinking about rapid testing that Quebec isn't using yet? For several months now, we've been hearing to what extent it's important to have rapid testing, and the federal government has done its work, approving tests, purchasing test kits, delivering them to provinces. I can understand that there are strategic steps as to how to deploy these tests in order to maximize their impact. We're there to work with the provinces to give them advice as well if they do need suggestions as to how to deliver and use these rapid test kits for a maximum effectiveness.
We've heard over the past many months how important it is to get new and different types of testing, including rapid tests. So we approved a range of new rapid tests, and over the past months have sent hundreds of thousands, actually sent millions of rapid tests to various provinces. They are being deployed in certain places in innovative and strategic ways, and in other places they're still determining exactly how best to deploy them. We are there with advice and counsel and recommendations if provinces need help in getting those rapid tests out in the best possible way to maximize the impact that it'll have on bending the curve and keeping people safe.
En suivi, Émilie?
Follow-up? Yes. I don't quite understand. You seem to have concerns, worries. You're concerned that the assistance you're sending out isn't reaching people, and I would like to know more about the freezers that Ottawa has purchased, the 126 freezers. Might there be problems, delays with delivery? In other words, we know that there's a lot of competition out there in the world to obtain these freezers. Are they going to get to us in time for the doses that are going to have to be stored before being distributed? Very good question. We know that for some vaccines, the temperatures for storage are minus 70 degrees. So these freezers are very specialized pieces of equipment. We've purchased some. We've received some of them already. Others are going to be delivered. We're very confident that we will have the necessary equipment once the vaccines are here.
Thank you, operator. Next question on the phone.
Thank you. Merci. Next question, Christy Kirkup, The Globe and Mail. Line open.
Hello, Prime Minister. This month, the Public Health Agency quietly updated its guidelines around aerosol transmission of COVID-19. And I'm wondering why your government hasn't been more forceful in the message on aerosols, so perhaps Canadians might better understand how COVID-19 is spread.
We've always known that there are greater challenges in enclosed spaces. The need for ventilation was something that we put forward this summer when we sent money to the provinces to help out with the back to school that included money that could be used for upgrading ventilation systems. So there has been a lot of science over the past year talking about the various impacts of potential aerosol transmission. We're going to continue to rely on the best advice of our doctors and scientists, of experts around that. We're going to continue to make sure that they are guiding the recommendations we put forward and how we put them forward.
Following up, Kirsty?
And I'm just wondering, Prime Minister, if you can bring me into the room with you and members of your team, even when physical distancing is in place, when you're inside with members of your team, do you wear masks?
Most of the time we do. We know that it's important to try and wear masks indoors as much as possible. Obviously, when we're in situations where an individual is speaking into a microphone, we tend to try and take off the masks, but many people will, throughout the course of a meeting, wear a mask for the entire time, even if there is appropriate physical distancing. We're all trying to follow the best advice of our public health officials. It's not easy, and I know people are getting tired of it, but we've got a few more months to hang on through this winter where we all need to do our part and make sure we're trying to flatten this curve across the country so we can get to spring in the best possible case as the vaccines start to arrive.
Merci. Opérateur, on va prendre une dernière question au téléphone.
A final question on the phone. Next question, Mélanie Marquis, La Presse. Thank you. Good morning, Mr. Trudeau. Premier Legault stated yesterday that he wanted a date for the delivery of the first doses of vaccine. Yesterday, when you spoke with him, did you give him a date? And if not, what did you tell him? Well, first of all, I underscore to what extent it's essential that we work together, the premiers of the provinces and the federal government, because we can only deliver these vaccines to citizens if we work together alongside provinces and territories. So we're providing them with all of the information we have. The great challenge is that we did an excellent job with a very diversified portfolio of various vaccines, the best potential vaccine portfolio in the world. And we have a high number of doses, a higher number of doses per citizen than any other country. But because of this, or rather we did this because we know that it's a new vaccine. Several companies are developing vaccines. We will see challenges with manufacturing, with delivery. In some cases, that's always the case. So we wanted to maximize our chances of being able to deliver vaccines to Canadians. There is certainly a desire to get to the starting gate as quickly as possible, and I can understand that as well. But we also have to talk about what's going to happen when we reach the end of the game. And our experts are saying that if everything goes well, we have a good chance of vaccinating the majority of Canadians between now and next September. So we're very well positioned, but we are going to continue to work with the provinces with all of the necessary information in order that everyone be able to do his or her share to deliver for Canadians in this difficult situation. With regard to vaccination, the public health authorities yesterday announced that 3 million Canadians approximately, that's 8% of the population, will be vaccinated in the first quarter of 2021. Do you deem that this is satisfactory? For January, February, and March, our experts worked very hard, not only to sign contracts with a maximum number of companies, but also to ensure that we could approve them, to ensure that they're safe for Canadians and deliver them as quickly as possible. We know that it's an extremely complex issue, but we're going to be ready as soon as the vaccines start arriving. They'll be approved and they'll be delivered in a safe way in partnership with the provinces and territories, because we know that we must move quickly.
Prime Minister, it's Annie Bertrand-Oliver with CTV National News. Canadian officials yesterday said that a decision on the Pfizer vaccine could come in just about 2 weeks. The Americans say that they'll get vaccination started within 48 hours of approval. So why can't you provide a timeline to Canadians on vaccine delivery and rollout, especially if we're just talking about weeks?
We are working extremely hard on approving vaccines. Our health experts, our scientists are engaged in rolling approvals of the 3 top vaccine candidates, including Pfizer. We are hopeful that things are going to happen quickly, but at the same time, we need to reassure Canadians, and we need to be able to say confidently that these vaccines are safe, which is why we're very interested in what people around the world are doing, but Canadian experts and Canadian scientists will be driving the safety of Canadians every step of the way.
But again, officials said that they will likely make a decision on Pfizer around the same time as the Americans, which is right now slated for December 10th, which means we could have a vaccine decision in 2 weeks. And I'm wondering, if it's just weeks, why did you only now appoint a general to oversee vaccine delivery? This is something the Americans did in the spring. Why did it take so long?
We have continued to work with the provinces on vaccine delivery and logistics since last spring. We've been engaged, understanding that a vaccine was the way we were going to get through this pandemic, and that's why from the beginning we signed one of the most diverse range of contracts of any country in the world for more doses per capita than any other country around the world. We are ensuring that Canadians will be protected and will be helped through this pandemic in the best possible way. We have a strong plan that works with the provinces, and we're going to continue to make sure that every step of the way we're there to deliver for Canadians. I can understand the eagerness with which people want to know, when is this going to be over? When are we going to get the vaccines? What we can say is we are working extremely hard to deliver as quickly and as safely as possible. And I know people are really eager to find out, when are we going to get to that starting line? When are we going to start giving people vaccines? And we're working as hard as we can to make that as quickly as possible. But at the same time, what really matters is when we get to cross the finish line. And the fact that the doctors highlighted that if all goes according to plan, we should be able to have the majority of Canadians vaccinated by next September puts us in very good stead. We're going to continue to do everything we can to deliver for Canadians, listening to experts, working with top people to make sure that we're doing this right and quickly and safely for all Canadians.
En français là-dessus.
We know that people want to know when they'll be able to get vaccinated. People are eager to know when we'll be finished with this pandemic. I understand you. We agree that this must be done as quickly as possible, but it has to be safe as well. This is why our experts, our scientists are working together in order to ensure the safety of Canadians. It's uppermost in their minds. We're looking at what is being done elsewhere in the world, but the decisions with regard to the safety of Canadians will be made by Canadian experts, as should be the case. The other thing is that people are eager to get to the starting line, to start vaccinating people. I understand, and we're doing our very best, but at the same time, we have to talk about when we'll reach the finish line. When will we have enough vaccine for everyone? And the announcement yesterday made by the doctors that we're expecting to be able to vaccinate the majority of Canadians before next September, well, it's very good news, and it is part of the reasons why we worked so hard to ensure that we get more doses per person in Canada than any other country, because we know that there are several companies developing these vaccines, and we want to ensure that no matter the best vaccine, the one that we obtain the quickest, we want to be well positioned. Christian Noël, Radio-Canada. The United States are saying that everyone there will be vaccinated between now and June. We're saying here that the majority of Canadians will be vaccinated between now and September. In the meantime, what impact will this have on our economy that we're not all vaccinated at the same time? And what will be the effect with regard to people's anxiety? We know that people are very anxious. We know that there are problems in that area, and we're thinking of the economy as well. But we've been there. The government has been there to support people with resources, with CERB, with assistance for small businesses, with help for small communities. We're going to continue to work with the provinces. We're also putting forward programs to help with mental health issues, to support people in their communities, to help them combat isolation. These are immense challenges that we're experiencing, but we know how to be there for each other in Canada. And as I stated, the Canadian government will continue to be there with you directly throughout the country. At the same time, we're doing our utmost to deliver quickly a safe vaccine. We want it to be delivered throughout the country, and we're going to continue to coordinate and work with the provinces and territories in order to achieve this. Major General Fortin has just been appointed. Other countries, as Annie stated, called upon their armed forces more quickly. This is going to be tricky. Are we going to be playing catch-up? Is it unfair to him to place him in this position? We've been working since May on vaccines. We've worked to coordinate the delivery of vaccines with the provinces. We're engaged in a strategy that has already delivered for Canada one of the best portfolios in the world with regard to access to various vaccines and with regard of the number of potential doses per individual, the highest number of any country in the world. We are doing our work. We have been working to prepare ourselves logistically. We can underscore the fact that things went very well. The federal government received our flu vaccines in the spring. We worked with all of the provinces in order for them to be able to deliver a record number of vaccines. There were challenges, clearly, but we did demonstrate our ability to vaccinate an awful lot of people, as we do every year. I'm very pleased to be able to announce that Major General Fortin will be in charge of this. But we've been working with the armed forces for a long time already on this very issue of mobilization to inoculate a record number of Canadians.
We've been working on vaccines since the spring. With the provinces, with scientists, and reaching out around the world to different companies so that Canada has actually locked in the greatest diversity and the most diverse portfolio of vaccines of just about any country around, and the highest numbers of doses potentially per capita for Canadians, because we know that this is a new vaccine and there are many different approaches out there, and some are going to work better than others, and some are going to face speed bumps along the way that cause extra challenges. And we knew that creating an array of opportunities for Canadians was one of the best ways of making sure that we would get through this the best possible way. We've been working through the summer with experts on vaccinations and on vaccination programs. We've been collaborating with the Canadian Armed Forces and their logistical abilities for a long while now, and that's why I'm so pleased to announce Major General Denis Fortin, who is going to be working closely with PHAC on logistics and delivery of this greatest mobilization effort Canada has seen since the Second World War. We are on this. We are delivering. We are going to continue to do everything we need in partnership with the provinces and territories, without whom we're not going to be able to get vaccines out to everyone, because that's what Canadians expect of all of us.
Hi, Prime Minister. Tom Perry with CBC. You indicated this week we're not first in line for vaccines. That's going to go to the countries that are making it and themselves. Critics have said, well, that puts us last in line. So I'm wondering, where do you think Canada stands? If there's a lineup for vaccines, a global lineup for vaccines, where is Canada? Top 5, top 10? Where are we?
I know there's a lot of focus right now on when do we reach the starting line? When do we start vaccinating citizens? And certainly we're working very hard on that. But our perspective from the beginning has been create the best possible portfolio of vaccine producers so that we maximize our chances of having the right one, getting the one that is delivered quickest properly to Canadians. And that's what we've done. And as along the way, we actually secured more potential doses per citizen than any other country in the world. So we're going to continue to work, and that race to get to the starting line first, I can understand. But this pandemic doesn't get over until we reach the finish line. And that's why the news that Canadians can expect, if all goes well, to have more than half of us vaccinated by next September is significant positive news. And that's from the experts. That's not from me. And I'm very much looking forward to continuing to work with the provinces on delivering on vaccines for Canadians.
Do you think it is possible, though, to say where Canada ranks in terms of all the countries in the world, where we stand in this lineup for the vaccine?
I think there's going to be a lot of analysis after the fact on how different countries approached in their strategies, how they were able to deliver for their citizens. I look forward to that work being done, but right now our focus is on doing everything we can to help Canadians through this right now. We have a strong approach, a strong plan to do that, and we're going to stay focused on that.
Hello, Prime Minister. Mike Blanchfield, the Canadian Press. You talk about this finish line or the starting line or lines. As you know, the team from the Canadian Centre for Vaccinology at Dalhousie University was supposed to be starting some clinical trials on a vaccine in partnership with CanSino Biologics. Chinese government didn't allow those shipments to come to Canada months ago. So how did this failed arrangement affect the starting point there and Canada's search for vaccine?
We knew that in searching for the right vaccine for COVID-19, which didn't exist, we needed to make sure that we weren't putting all our eggs in one basket, that we were looking for a range of vaccine candidates to make sure that whatever actually ended up delivering on the vaccine, Canada would have an agreement with. So we've reached out over the past many months, over the summer, to sign deals with 7 of the top potential producers around the world. We have access to even more through the COVAX International Facility on Vaccines, and we have made sure that Canadians would be well served by this vaccine strategy. We will continue to work on all the various promising vaccines out there and on getting them to Canadians. But we can know that the work that our experts, that our Minister of Procurement did on making us in a solid position to get through this should be something that Canadians can take pride and reassurance in.
When this is over, who are you going to hold accountable for this failed deal? And what's the biggest question on your mind right now that you want answered before you can authorize the first dose of a vaccine to a Canadian?
Well, I think the question we all have is it going to be safe? Is it going to be effective? That's what our scientists are looking at very, very carefully right now. And that's, quite frankly, why we knew that moving forward on a diverse range of options was our best chance. There are jurisdictions and countries around the world that have banked everything on 1 or maybe 2 different vaccines. We've got signed deals with 7 different vaccine makers and through COVAX facility access to up to 12 different vaccines. Whatever vaccines end up being the right ones to get through this pandemic, Canadians have a very good chance of having access to millions of doses of those. That's the work that we did as a government because we knew that securing vaccine access for Canadians, that ensuring the safety of those vaccines through the work of our top scientists and health officials is going to give people the confidence and reassurance to get through this as quickly as possible. Okay. Nous savons
We know that the very first concern of everyone is the vaccine that we're going to distribute going to be safe and effective? The protection of people's health is our absolute priority. That's why our experts, our scientists at Health Canada are, yes, looking at what's going on elsewhere in the world, various studies, but they're also analyzing the data and carrying out verifications themselves, because we will only distribute a vaccine if it is deemed safe for Canadians. At the same time, because there was so much uncertainty as to which vaccine would be delivered, we chose to sign agreements with 7 different manufacturers to get comprehensive deliveries through the COVAX facility. So depending on the vaccines that will be most effective, it is very likely that Canadians will have access to those vaccines because of the work the government has done since the summer. There are countries, places in the world that only have access to 1 or 2 different vaccines, and they're hoping that those will be the vaccines that will work. In Canada, we secured access to a broad array of vaccines so as to ensure that as soon as one of them is proven to work, as soon as one is proven to be safe and effective, we'll be able to deliver it to Canadians.
Merci tout le monde. Bonne fin de semaine.
Thank you, everyone. Have a good weekend.
All right, that is the Prime Minister of Canada on this Friday, giving a semi-regular, I'm going to call it, update on the pandemic in various parts of the country. A couple of interesting things I think we want to talk about before we bring you to the Public Health Agency's briefing, which will be starting shortly as well. I'll bring back my colleagues, Catherine Cullen and David Cochrane. I'm going to start with you, David, on vaccines and whether we learned anything there new above the Major General that we've been talking about. Danny Fortin, who will be leading part of this logistical challenge for the government.
Yeah, we have there, it's kind of a repeat of what we heard yesterday, that the hope from the doctors who are actually leading this vaccine effort is to have the majority of the Canadian population vaccinated by the fall, September, as the Prime Minister said. So that's the first time we've heard an elected official give September as a time when the majority of Canadians can expect to be vaccinated if things go well. And my sense, Rosie, is what is happening. I mean, they would have been aware of those timelines on Monday, on Tuesday. I get the sense that what they want to have happen here as a government is for the officials to say it first. So then that pronouncement becomes a technical statement from an expert with a medical degree or a PhD behind it, rather than a statement by a politician. And they really want this to be a doctor and expert-led process rather than a politically led process. So hence the prevarication and the lack of clear, specific answers earlier in the week on timelines until Dr. New, Dr. Sharma, and Dr. Berthoum were out yesterday speaking to us in that technical briefing where they gave us those timelines.
Yeah, a more cynical thought might be that that way, if something goes wrong, you don't actually take as much blame politically. We'll see if we get there, but keep going. Yeah,
but the experts are going to make the decision on whether we can use these vaccines. I think the last thing anybody in Canada wants is the cabinet deciding if a vaccine is going to be safe or not, right?
With all due respect to the cabinet, yes, indeed.
I mean, sure, stick to your knitting. The military announcement, though, is interesting. When you talk about the things that the military is going to be responsible for in the vaccine distribution, the cold storage, the data sharing, and the Indigenous and rural communities being connected. Those are the data sharing. Doesn't sound very sexy, but that really matters because that's essentially tracking who gets needle 1 and when do they get needle 2 to give a very clear sense of when the population is actually at a critical mass of vaccination, and also just to coordinate centrally getting an idea of where Canada is on the vaccination curve. But you know what, thematically what I kind of take from the Prime Minister today is what he said in the beginning about the numbers, that we are in for some of the toughest months of this pandemic. And, he used sort of the Game of Thrones line of winter is coming. It reminds me of the other expression, it's always darkest before the dawn. We have this hope and the light of the vaccines coming at some point rolling out over the course of the next year. But we have those record numbers in Ontario today, daily record numbers in a lot of the western provinces. And, as we know from dealing with this, hospitalizations and deaths are lagging indicators of those numbers. So the 1855, I believe it was in Ontario today, 2 weeks from now, some of that will be hospitalization. 3 weeks from now, a percentage of that will be deaths. So he's right when he says we're heading into this dark period while at the same time the regulatory officials are getting ready to make a yay or nay decision on the Pfizer and Moderna vaccines. And now a former Major General Danny Fortin, who led the NATO mission in Iraq, has been tasked with logistics and distribution as they try to get the provinces all on side with a centralized plan. And Ontario Premier Doug Ford has got Rick Hillier, the former general, also going to head up vaccine distribution here in this province. So things are moving, maybe not at a speed and a pace an impatient public and certainly a critical opposition would want them to be moving at. But you know, Rosie, some of the pronouncements we've seen from other countries like the United Kingdom giving very firm vaccine dates on doses, a lot of that is dependent on the AstraZeneca vaccine. And as we've seen this week, there are questions about the data that went into the clinical trials and the effectiveness of that vaccine. So we don't know if those are firm dates. So they're being very reticent to give specific dates for a bunch of reasons as opposed to other nations. And really, we won't know until several months from now whether that was the right and accurate approach or not.
Yes. Yeah. The other point that he made that I pulled out there, and I'll get you to talk about it a little bit, Catherine, in light of the conversation with the premiers, there was a phrase early on in his speech where he said, we expect this support, when he outlined all the support they are delivering to provinces and territories, we expect this support get to people and communities. And that was, that stuck out for me a little bit.
I think a few of us went, what precisely is he talking about there? I understand that one very good example of that is reporting in the Journal de Montréal today, which says that Quebec has received 1.2 million rapid tests. Those are both the Abbott PanBio and the ID Now tests. But the tests are not being used now. And according to that report in the Journal de Montréal, there's still a validation verification going on Quebec's part to ensure that the tests work within the system, that they're effective and whatnot. But it is pretty clear from that comment, which just, sort of slid in there. It wasn't necessarily too pointed, but I think anybody who was listening might have said, well, what is he talking about there? That there's some consternation on the part of the federal government that they have gone to the effort of making these tests and there has been a lot of discussion around rapid tests in particular, making them available. They do not simply want to see them sitting there. I'm told it isn't really just about Quebec, that there have perhaps been other instances of this, something that might have come up over the course of the conversation last night with the premiers as well, although also a lot of emphasis, obviously, on vaccination in the course of last night's conversation. One of the thing that I thought was quite interesting, Rosemary, was the Prime Minister's repeated reference to the finish line that we, and we've talked about that before on this on these specials, right? That there is a lot of attention on when that starting gun goes off. When do the vaccines actually arrive in Canada? I think everybody can understand why that is. But he talked a lot about how this is about the finish line. Well, what is the finish line? I mean, I think that's the question that is begged by that particular remark. The Prime Minister talked again and again about September today, but of course that is not the finish line. He's talking about a majority of Canadians being vaccinated, a situation that many of us would hope for. Dr. New yesterday from Public Health talked about all Canadians who want one being vaccinated by the end of 2021. Is that the finish line that we are talking about? Is everyone who wants a vaccination going to be enough to address this? Those questions do seem in many ways very far away right now when we still haven't received the vaccine. We're still talking about the when of the beginning of all of this. But as the Prime Minister continues to use that phrase, it really does point to some reflection about the bigger picture in all of this and what our bigger aspirations are as Canadians. Obviously, it's to get rid of COVID, but what does that require? What does that look like?
David, do you want in on that?
Yeah, I don't think the finish line is 100%, right? Because I think we've heard medical experts, and correct, I apologize if I'm wrong on this, but like a number of around 70% immunity is where they kind of want to be for vaccinations and stuff.
But will that be every Canadian who wants it, right? Like that's a question that I think neither you nor I can answer, David, but it's such an important one.
No, I'm trying to explain what scientists like Dr. Fauci in the United States has said is if you can get to about 70% effectiveness and population penetration, this is a level where you can open up more. You can gradually reopen the economy on a lot of things. Right. I mean, just getting vulnerable, high risk and healthcare workers vaccinated is an enormous relief to the lockdowns and the restrictions we had to live with as a society, and then you build out from there. Because if you look at the vast majority of the 12,000 deaths in this country, they have been vulnerable populations in congregate living conditions, primarily in long-term care. And if you we couldn't keep it out of there, but if you can get the vaccines in there right away, that takes an enormous strain off the system. So getting to a certain percentage of the population, there is science on this, that if you get there, because we don't have 100% vaccine take up on measles or chickenpox on a lot of things, but we have it at a critical mass level that there is broadly societal protection. So I think the goal is to get somewhere around there. Again, we'd really like a clear definition of this, to Catherine's point, from the federal government.
Yeah.
Like, we need this explanation from the people making all of these decisions.
Yeah, and a lot of that too, and the Prime Minister referred to that, is reassuring people about how the approval process unfolds. You know, you're happy to hear that Canada is working with the FDA in the United States, but you would also want to be reassured that Canada is following its own regulatory process, so that then becomes part of getting Canadians to trust the vaccine and be interested in getting the vaccine, because those numbers have softened since April. Catherine, I'll let you.
Yeah, I guess, and I apologize if I was unclear, but I suppose that's the point I was driving towards, is ultimately how many Canadians, when Dr. New talks about all the Canadians who want one being able to get one, it is still an open question at this point. We know there are going to be public education campaigns, right, trying to convince Canadians of the safeness and efficacy of these vaccines as they're rolled out. I'm just saying that it's a really important part of the picture, and as the Prime Minister was saying, a lot of emphasis on the beginning here, and those questions, I mean, they are going to continue. We didn't get a date today. I don't think we're going to get one tomorrow. The questions aren't going away, and I think there's a challenge for the federal government too. You look at the questions that the reporters asked today, so many comparisons to the United States. Now, that challenge is an interesting one at this moment. Of course, we want to see what happens in the U.S., and I did think one last point that it was quite interesting when the Prime Minister did perhaps a little bit of foreshadowing in one of his answers, where he did say, we will see challenges with manufacturing, with delivery. That is always the case.
Yes.
We don't know where in the world those are going to be, whether it's going to impact Canada, the United States. I mean, there's so many unknowns, but just more reason to reflect, I think, about where all this is going.
Before I let you go, I just want to flag the other thing that the Prime Minister announced, because it is significant. There's a lot of money behind it, and it's important to a lot of people in this country. $542 million, additionally, on top of another $3 billion that was previously budgeted in 2019 to get Indigenous communities across this country to be able to build and put in place their own child and family services, so that they can look after their own children their own way without having to depend on provincial child welfare programs that have failed many of those communities through a very long time. It's a lot of money, and it flows from a piece of legislation that was passed. So wanted to make sure that we also flagged that happened today. Thank you both very much, David Cochrane and Catherine Cullen. Catherine is guest hosting Power and Politics today. You can catch her at 5 Eastern. Here now, government and public health officials going to give more details on other things around the pandemic. Natasha Fatta will pick up our coverage from here on CBC News Network. Let's listen in live.
Good morning, everyone. Or good afternoon, I should say. Aujourd'hui, nous allons entendre Dr.
We're going to be hearing Dr. Tam, who is our Chief Medical Officer at PHAC, Dr. New, the Deputy Director of the agency, Minister Miller, Dr. Wong, and Dr. Wong will be with us virtually. We also have with us Patty Hadu, who will be able to answer questions, as well as Minister Anand, who is with us but virtually. I would, however, like to begin by reminding everyone of the important announcement made by Mr. Trudeau. Major General Danny Fortin will be leading the vaccination initiative from headquarters.
The important news that the Prime Minister shared earlier, that Major General Danny Fortin will lead the vaccination logistics of the National Operations Centre. Madame la Dr. Tam.
Bon après-midi, bonjour.
Good afternoon.
There have been 353,097 cases of COVID-19 in Canada, including 11,799 deaths. Nationally, there are 60,375 active cases across the country. And over the past week, labs across Canada have tested an average of over 75,500 people daily, with 7.6% testing positive. The national average case count is now over 5,300 cases reported daily over the last 7 days. With continued rapid growth of the epidemic over many weeks in a growing number of health regions across Canada, the troubling rise in the number of people experiencing severe illness continues. Over the past week, there have been, on average, over 2,100 individuals with COVID-19 being treated in Canadian hospitals, including over 430 in critical care and 76 deaths reported each day. Large weekly increases in new infections are being reported in many jurisdictions, with the highest daily numbers being reported in provinces west of the Atlantic region. In particular, sustained high case numbers in Quebec and Ontario and rapid growth in cases in Alberta means these three provinces currently account for almost 75% of daily cases reported nationally. All jurisdictions are implementing a range of public health measures and urging their populations to do everything they can to limit contact with people outside of their household. Ultimately, the concern is the same everywhere. Continued spread of COVID-19 puts a strain on healthcare and essential services and threatens to overwhelm our capacity to respond. We are all in this together, and impacts will affect all our well-being, which is why we are being called upon to take action to reduce the spread of the virus. If we continue on the current pace, our longer-range models continue to forecast significant increases in daily case counts and estimate that there could be up to 10,000 cases reported daily by mid-December. Right now, we have a window of opportunity to act collectively with public health authorities to bring the infection rate down to a safer trajectory. Two things are being asked of us: to follow local public health advice as measures are introduced for controlling spread across the population, and to strictly and consistently maintain our individual protective practices to help prevent infection and spreading the virus. Stay home and self-isolate if you have any symptoms, even mild ones. Clean your hands frequently, maintain physical distancing, wear a face mask when around people outside of your immediate household, and avoid or limit time spent in the 3 Cs: closed spaces, crowded places, and close contact settings and situations. As with our last effort to bend the curve, and more so now, this is not going to be a quick solution, but a test of our determination and endurance. While now is not the time to gather, we can take comfort in knowing that the sacrifices we are making today are for our tomorrow. Now is the time to plan holidays that are safer and still allow us to maintain our important traditions, finding new ways to celebrate, connect, and support each other. With resilience and resolve, let's focus on the things we can do, including doing our utmost to protect our families, friends, and communities. Thank you.
Bonjour à toutes et à tous. On a signalé
Welcome, everyone. There have been 353,197 cases of COVID-19 in Canada, including 11,799 deaths. Nationally, there are 60,375 active cases across the country. Over the past week, labs across Canada have tested an average of over 75,500 people daily, with 7.6% testing positive. The national average case count is now over 5,300 cases reported daily over the last 7 days. With continued rapid growth of the epidemic over many weeks in a growing number of health regions across Canada, the troubling rise in the number of people experiencing severe illness continues. Over the past week, there have been an average of over 2,100 individuals with COVID-19 being treated in Canadian hospitals, including over 430 in critical care and 76 deaths reported each day on average. Large weekly increases in new infections are being reported in many jurisdictions, with the highest daily numbers being reported in provinces west of the Atlantic region. In particular, sustained high case numbers in Quebec and Ontario and rapid growth in cases in Alberta mean that these three provinces currently account for almost 75% of daily cases reported nationally. All jurisdictions are implementing a range of public health measures and urging their populations to do everything they can to limit contact with people outside of their household. Ultimately, the concern is the same everywhere. Continued spread of COVID-19 puts a strain on healthcare and on essential services and threatens to overwhelm our capacity to respond. We are all in this together, and impacts will affect all of our well-being. And this is why we are being called upon to take action to reduce the spread of the virus. If nothing changes, our long-term models continue to forecast significant increases in daily case counts and estimate that there could be up to 10,000 cases reported daily by mid-December. Right now, we have a window of opportunity to act collectively together with public health authorities to bring the infection rate down and flatten the curve towards a safer trajectory. We're just asking us to do two things: follow local public health advice as measures are introduced for controlling spread across the population, and to strictly and consistently maintain our individual protective practices to help prevent infection and virus spread. Stay home and self-isolate if you have any symptoms, even mild ones. Clean your hands frequently, maintain physical distancing, wear a face mask when around people from outside of your immediate household, and avoid or limit time spent in the 3 C's: closed spaces, crowded places, and close contact settings and situations. As with our last effort to bend the curve, and more so now, this is not going to be a quick solution, but a test of our determination and our endurance. While now is not the time to gather, we can take comfort in knowing that the sacrifices we are making today are for our tomorrow. Now is the time to plan holidays that are safer and still allow us to maintain our important traditions. Finding new ways to celebrate, connect, and support each other. With resilience and resolve, let's focus on the things that we can do, including doing our utmost to protect our families, our friends, and our communities. Thank you.
Thank you, Dr. New. I would like now to invite Minister Mark Miller, Minister of Indigenous Services.
Merci Jean-Yves Coué.
Thank you, Jean-Yves.
Good afternoon, bon après-midi. We continue to see an alarming increase in COVID-19 cases across Canada and Indigenous communities. We've seen a number of outbreaks in regions that had fared well during the first wave of this pandemic. First Nations, Inuit and Métis in regions such as Manitoba, Saskatchewan, Alberta and Nunavut are experiencing an active infection rate that is close to 4 times the total number of Indigenous peoples infected by COVID-19 during the first wave. This is exceedingly serious. To ensure Indigenous groups and communities have resources they need to successfully prevent, respond, and limit the spread of COVID-19, particularly in those 4 regions, we have recently allocated over $200 million in immediate funding. Just this week, we allocated $19.3 million for efforts in Nunavut to support the various priorities identified by leadership and communities, including support for vulnerable populations, support for long-term care homes, deploying additional staff in communities with outbreaks, strengthening mental health services, and additional isolation and screening spaces where needed. We
have also granted $120 million to support Aboriginal communities and organizations in Alberta, Saskatchewan, and $61 million to support the First Nations of Manitoba and their response on the ground. We will continue to support the efforts deployed on the ground to ensure that these individuals, communities, and organizations have the necessary tools to contain the repercussions of COVID-19 for the health and livelihood and lives of Aboriginal peoples.
At the end of the year, we are also approaching the 1 year since the Act respecting First Nations, Inuit, and Métis children, youth, and families came into force. This historic legislation was co-developed with Indigenous partners to reform child and family services with the aim of reducing the number of Indigenous children in care, as well as enable First Nations, Inuit, and Métis to exercise their jurisdiction over child and family services so that they can decide what is best for their children, their families, and their communities. In order to thrive and fully reach their potential, children and youth need to have solid supports and resources, strong ties to immediate and extended families, as well as ties to their home community and cultural connections. Sadly, this is not the reality for far too many Indigenous children. According to the 2016 census data, Indigenous children make up over half of all children in foster care, even though they only account for less than 8% of all children aged 0 to 14. But behind these devastating numbers, there are real children, real and terrible stories, and these stories shouldn't happen to anyone, much less to innocent children. The overrepresentation of First Nation, Inuit, and Métis children in the child and family services system has been described as a humanitarian crisis. It is a crisis, and anyone who has seen the groundbreaking reporting of Kenneth Jackson knows that this is an ongoing crisis, but it's a crisis that we must have the courage to address head on. That is why First Nations, Inuit, and Métis communities are best placed to determine their needs and ensure their children, youth, and families thrive. Today, Prime Minister Trudeau announced an investment of over $542 million to advance the implementation of the Act. It's an important next step for the full and successful implementation of the Act. It'll ensure that it is funding First Nations, Inuit, and Métis groups to work within and across their communities to build strong foundations and support them in engaging communities and hiring experts to develop models and legislations. In addition to this funding, and in order to provide initial support, a first wave of funding totaling $12 million was already allocated to 26 First Nations and Inuit groups, which had identified an immediate need to begin their work and explore Indigenous-led children and family services delivery models. We will continue to engage and work with partners to identify needs for funding that support their jurisdiction over child and family services. We also need to recognize that the uncertainty that COVID-19 brings to youth that would normally age out of care during this time. To make sure that they get the support they need, we will continue to cover eligible costs for First Nations, child and family service agencies providing services to youth who would normally be aging out of care during this time, and do so as long as the pandemic lasts. Les enfants et les jeunes sont des symboles d'espoir.
Children and youth are symbols of hope for a better future. They challenge us to do better, to think outside the box, to innovate. To thrive and reach their full potential, they need support and stable resources, but also strong family and community ties, including a strong connection with their languages and traditions. The overrepresentation of First Nation, Inuit, and Métis children in child and family services has been described as a humanitarian crisis. It is one. We must have the courage to confront this crisis, this systemic discrimination. The $542 million investment announced today, along with the Act respecting First Nation, Inuit, and Métis children, youth, and families, is an essential step to correct our errors of the past. We know that there is still work to be done. We will continue to work with our Indigenous partners to assess the needs with regard to long-term funding and to respond to these needs.
Putting First Nations, Inuit, and Métis children first, so that they can stay with their families and communities and grow up immersed in their cultures and have greater opportunities to thrive and reach their full potential. This is not a promise that I or the Government of Canada take lightly. There's no doubt that we still have a long way to go, but this is an investment and it is a key step in the right direction. A step towards keeping our promise to Indigenous children and families and to unleashing the potential that I have no doubt will change our nations and our world for the better. Miigwech, Nakumik, Marcy Cho, thank you, merci.
Merci beaucoup, Marc.
Thank you very much, Mark.
Dr. Tom Wong, Chief Medical Officer of Public Health at Indigenous Services Canada.
I want to acknowledge that I'm on the unceded territory of the Algonquin people. As of November 26th, 1,392 First Nations on reserve active COVID cases have been reported. And this compares to over 60,000 active cases reported in the general Canadian population. Sadly, there have been 30 on-reserve fatalities, with a case fatality rate that's a quarter that of Canada's. Canada has reported over 11,000 deaths. Nous reconnaissons.
We recognize the value of Indigenous-led access, collection, and analysis of data. This will contribute to supporting First Nation, Inuit, and Métis communities in the promotion of approaches that are culturally adapted and based on evidence. For example, we support the efforts made to reinforce the governance capacity of Indigenous peoples with regard to data. For example, the funding granted to the First Nations Information Governance Center for efforts tied to the fight against COVID-19.
The general Canadian population and in Indigenous peoples is heartbreaking. This calls for our collective efforts to listen to the elders, to redouble our public health efforts, to limit non-essential travel, practice hand hygiene, stay 2 meters apart from people not within our household bubble, wear a mask, avoid gatherings, stay home if we are sick, if we are infected, or if we are in isolation. And most importantly, be kind, support each other, and do everything we can to protect our elders. We are in this together. Miigwech, Nakumik, and Marcy.
Merci, Dr. Wam.
Thank you. As we were saying earlier, Minister Anand and Minister Haidu are available to answer your questions.
Minister, as usual, we're going to start on the phone. One question, one follow-up, and we will then turn to the room. Operator, over to you.
Thank you. The first question is from, la première question est de l'INADIB de la presse canadienne. Please go ahead, à vous la parole.
Oui, bonjour. Question. Yes, my question is for you, Dr. New. Last week, on Tuesday, you told us that you were hoping that the great majority of Canadians would be vaccinated before the end of next year. I'm hearing an echo. It's somewhat troubling, says the reporter. And this morning, Mr. Trudeau stated just an hour ago that he thinks that the majority of Canadians will be vaccinated between now and September. So I would like to know where this precision comes from. Is it your information? It's become even more optimistic than what we've heard from you in the past. Answer. Thank you for the question. Clearly, the objective is always to vaccinate, or at least to offer vaccination to the majority of Canadians between now and the end of next year. I was optimistic. I think that about a week or two ago, I made statements, and perhaps the Prime Minister was able to refine the information. It's a project with adjustments that have to be made along the way. But we now have support with the Major General Fortin, who's now part of our team. We're even better positioned now to organize ourselves for vaccination for Canadians. There are also unknowns. We are still in the approval process with our colleagues at Health Canada. They still have to revise all of the evidence, the clinical trials from Pfizer and Moderna. And we are also waiting with optimism. We're awaiting information about the other 5 vaccine candidates to see what the results are. The results have been good. We'll have to see if they're all approved. There might be a whole array of vaccines, and it's difficult for us to say what the timetable might be for the delivery of these vaccines, because they haven't yet been approved. But overall, I agree with the Prime Minister. We're expecting that a majority of Canadians will be able to be vaccinated in the fall or towards the end of next year. Thank you. Dr. New is going to repeat his answer in English.
The schedule for vaccination, certainly we've always been sort of optimistic, cautiously optimistic about what the vaccination rollout will look like. I think I said about a week or so ago that certainly by the end of next year, we would hope to offer vaccination to the majority of Canadians. I think the Prime Minister this morning or today sort of elaborate further, and I think he mentioned maybe a date of September. I think it's all in the same ballpark. I keep using my sports analogies in the sense that right now it's a bit of a moving target. We have 2 vaccines which are very promising, but they're still in the process of, quote, going through the regulatory process. If all goes well, and they are approved, then they're the first 2 out of the pipeline. What we also anticipate is that with the other 5 candidates that we have, if all goes well with their results of the clinical trials and the data coming in and so on, and they get approved, then we will have really what I say a suite of vaccines to be able to offer Canadians, because we do have obviously advanced purchase agreements for all of these vaccines. And with all that in play, it's still, I think, a bit of an unknown. There's lots of moving parts in terms of what the schedule are, delivery, et cetera, and so on. But certainly, I think a major addition as well that the Prime Minister announced today is with the addition of Major General Danny Fortin to our team, I would say, Team Canada, to hopefully, like I say, bring this all together, certainly focusing on the logistic aspects. I think I mentioned last week that the Canadian Armed Forces certainly bring a unique expertise in the field of logistics, and we're looking forward to having them on board.
Follow-up question? Yes, just to be clear, Dr. New. You're saying between now and September, September is still the summer. The end of September is still the summer, and the Prime Minister is saying that the majority of Canadians will be vaccinated by then. Answer. Yes, I'm always in agreement with our Prime Minister. Technically speaking, we're continuing to work very closely with our counterparts in the provinces and territories. An awful lot of people are working very hard behind the scenes, and it is good to have an objective for planning purposes. We're targeting September, but we have to be realistic, and I could also say that yes, the end of December is out there, but if we can move more quickly, it'll be better for everyone.
Thank you, Doctor. Operator, next question, please.
Thank you. The next question is from La prochaine question est de Janice Dixon from the Globe and Mail. Please go ahead. À vous la parole.
Hi, my question is for Dr. Tam. Why did Canada update its guidelines on aerosol spread in November after other countries and international organizations?
So aerosol is, I think we have to recognize there's a range of droplet size when someone coughs, speaks, sing loudly. Aerosols are the smaller of range and can get suspended in the air for longer. So just to set the stage. And we have, since probably June, been advising on, avoiding and minimizing close contact, close spaces, poor ventilation, and crowded spaces as well. So really, that's the key, and also, of course, wearing a mask. So I think from that perspective, we've always recognized that there's always a range of unknowns, and that the public health advice had been provided as early as that point in time. There's much in the way of evolving science and knowledge, and so in the Canadian context, many experts have been discussing this for quite some time, and so as a result, one of the key updates is because we're about to move into a time when everybody is going to have to gather inside and not sort of stay. Well, it's more difficult to stay outside. So the emphasis on doing as much as we can to reduce the risks of transmission in those are the 3 Cs, add to a few more Cs, continuous exposure, so longer duration of exposure, and others is the key. So that doesn't change. What we're also trying to do, we've given some preliminary advice, which is just make sure your HVAC is well maintained. Open a window, go outside if you can, even in the winter. And in Canada, we can do that in the winter too. You can still go outside whenever possible, are the key advice. But we'll continue to work with experts who are more in the field of ventilation and update or get them to update guidance and approaches accordingly.
Janice, follow up? Janice? Okay. Operator, next question, please.
What? Perfect. The next question is from, la prochaine question est de Émilie Bergeron from Agence QMI. Please go ahead, à vous la parole.
Oui, bonjour. Question. Mr. Trudeau this morning stated that the majority of Canadians would be vaccinated by September, but he also stated in English more than half of Canadians would be vaccinated by then. Does that mean that in September we're expecting that a little bit more than 50% of Canadians would be vaccinated, or are we thinking more about 90% or more? Answer, Dr. New. It's very difficult to talk about precise numbers. I think that the Prime Minister is optimistic. I am too. There are a lot of unknowns, as I outlined previously. Even today, we don't yet have approved vaccines here in Canada. The most important thing is to have safe and effective vaccines here in Canada, approved by our colleagues at Health Canada. With the approval, perhaps, of these two vaccines, Pfizer and Moderna, perhaps we're looking at delivery of some 6 million doses in January and February. We're going to start offering vaccination at least, to our priority groups, such as vulnerable people in long-term healthcare facilities, perhaps essential workers, such as healthcare workers. Beyond that, it's difficult to say, because if we're talking about September or December, that's several months away. And as I also stated, we have 5 other candidate vaccines, and we have to see what's going to happen with the results of their clinical trials. And there's the approval process, etc. There are a lot of unknowns, as I say, and we can't give a month and a precise percentage of the population that would be vaccinated. Also, as I've previously stated, it's a good step forward, and we now see that we will have the support of our armed forces with Major General Danny Fortin. This is a good step. He's now part of our Team Canada, and he will help us respond to all of the logistical challenges, because how should I say, this is part of our vaccination program, but it's not just the federal government. We always say that we're in close cooperation with our counterparts in the provinces and territories, and also the leaders of Indigenous organizations. So all of the players at all levels of government are on board together. Thank you. Follow-up? Yes, question? Question for Dr. New. Yesterday, you stated that it was optimistic, your projection that the great majority of Canadians would be vaccinated between now and the end of the year. So, what have you to say about Prime Minister Trudeau's projection announced this morning that it would be the majority of Canadians before September? That's earlier than what you put out there. And you qualified your statement as optimistic. Answer, I believe that what the Prime Minister stated this morning was good, because it's a target. There are an awful lot of people within the federal government and in the provinces and territories who are working on this. If the Prime Minister set September out there as an objective, that's fine, because we're continuing to work hard so as to be able to offer vaccination to the majority of Canadians. So if it's September or December, for me, it's just a matter of months. But we do have to pursue our efforts now.
Merci, Dr. New. We'll now turn to the room, starting with Mackenzie.
Hello, everyone. Mackenzie Gray from CTV News. First part of my question is for Minister Hajdu and Dr. Tam. Was there any consideration to use either the GlaxoSmithKline plant in St. Foy or the Sanofi plant in North York to produce vaccines domestically? And in the same vein for Minister Anand, why did none of the 7 vaccine contracts that we have any option for Canada to use the IP that the vaccine companies have had to domestically produce vaccines once we get to that capacity?
I think I'll start and then turn to Minister Anand. Thanks for the question, Mackenzie. And I think the Prime Minister said it well when he described the loss of biomanufacturing capacity in Canada over the past several decades. And of course, given that, we knew that we had to be aggressive in securing options for Canadians of vaccines that would represent a variety of different kinds of vaccines and also a variety of different manufacturers. And we didn't do that alone. We used the Vaccine Task Force to guide our work. In fact, these are hardworking volunteer Canadians who are volunteering to help their country. They're experts in pharmaceutical industry, in virology, scientists and researchers that are providing advice to Canada, and that's why we're so well positioned with this portfolio of very diverse vaccines, but also very promising ones. In fact, we were the first country in the world to have all 3 that are showing effectiveness now under regulation in the world. So and now there are other countries that are reviewing all 3, but we were the first country in the world to have submissions from those 3 companies. It just, I think, speaks to the quality of advice that we've received from the Vaccine Task Force. And I'll turn to Minister Anand for the rest of your question.
Thank you so much, Patty, and thank you for the question. When we entered into agreements for vaccine candidates in August, September, and October, based on the recommendations of the Vaccine Task Force, we, of course, took into account Canada's production capacity. One of the key criteria involved in the negotiation of the contracts was what would provide Canadians access to vaccines as early as possible. While we explored the possibility of domestic manufacturing with a number of vaccine developers, the quickest path to supplying vaccines to Canada would be from their international supply chains. At the same time, Canada also made significant investments to rebuild our biomanufacturing capacity, for example, by investing $126 million into the NRC's Royal Mount facility, as well as in Medicago and Vito Intervac. So I'd like you to think about it as a 2-track process. First, ensuring that we have a diverse portfolio of vaccine candidates, which we have now secured, with the most doses per capita of any country in the world, for Canadians. And second, to, at the same time, bolster domestic manufacturing, make sure we are investing in domestic facilities so that we are not precluding the domestic option, but we are ensuring that Canadians have access to vaccines as soon as they are approved by Health Canada. Thank you.
Many other countries have been able to outline quite clearly the delivery date for vaccines. So for Minister Anand, in the contract with Pfizer, can you tell me the earliest date that Canada could receive a vaccine? And if you can't tell me, why did we sign a contract that cannot give such basic information out to Canadians?
Well, thank you for that question, and I want to make sure that we put these deliveries in context. We should and must think about the inoculation of all Canadians, not only the first Canadian. And that is exactly what the Prime Minister was suggesting in his remarks this morning. Having said that, and as a former professor of contract law, I can assure you that we put in place contracts with Pfizer and Moderna and the other suppliers that indicated once we have Health Canada approval, deliveries will start as soon as possible. The most important thing to remember, and we've been consistent about this at the outset, is that we can expect deliveries in the first quarter of 2021. And we put contracts in place with these 7 developers to ensure that Canada has the greatest access of any country in the world to the most diverse portfolio of vaccines in order to ensure that Canadians are well placed, and indeed now better placed than any other country, for access to vaccines. And in terms of your question regarding a precise delivery date, I want to indicate that it is very important to remember that we put these contracts in place, recognizing that there may be uncertainty around the timing of the discovery of a vaccine, which we are still waiting for, and the finalization of approval from Health Canada. Those are 2 points that are uncertain in time. And we are constantly in touch with our suppliers, me included, almost daily with our suppliers to ensure that when Health Canada approval is forthcoming, we can then roll out vaccines to Canadians. This is a complex process. This is an uncertain environment, but we are on top of it. And I personally will make sure that we have vaccines in place in Canada once Health Canada has provided its regulatory approval. Thank you.
Thank you, Minister. David?
Hi, David Thurton, CBC News. Dr. New and the Prime Minister have both said that they are hoping to vaccinate the majority of the Canadian population by the end of next year. So, Dr. Tam, can you tell us what level of vaccination do we need to see in Canada to protect Canadians against COVID-19? Is it 50%? Is it 60%? What is the success rate? What's the uptake rate that you need to see?
There's 2 aspects to the objective of immunization. Obviously, the first is to protect the individual. So some of the data that would be submitted to the regulator is about the effectiveness and safety for the individual that's getting the vaccine. As far as I know, we will not necessarily get any data about the effectiveness of the vaccine against transmission to someone else. So that's another kind of information that would be required. So I think, and the immunology, the immunity of the human body to both the virus and the vaccine is still being studied. Having said that, another key objective is we hope that by vaccinating large number of people who would get the vaccine, that you might be able to protect others. So that's the concept of herd and community immunity. I don't think anyone has an actual precise number for that. There's all sorts of modelers who are sort of projecting different levels. In general, you just want as high as possible. And it depends. Every vaccine has a different characteristic. And we don't know enough about the vaccines coming out as yet. So that would be the most sort of reasonable answer, I think. But the Health Canada and other regulatory threshold is not about a herd immunity threshold. That is about vaccine efficacy or effectiveness for those who are receive the vaccine versus those who don't. So I think we will come back to you with that answer. You hear lots of opinions, but I think right now we don't know the exact answer to that question.
So bear with me here. I've just got a text from my French colleague, Minister Anand, if you could repeat your question to CTV in French. But before we do that, just another question, and this is maybe for Dr. Tam or possibly for the Health Minister, Ms. Haidu. What's going to be the basis for deciding how many doses each province, each territory, each nation, or Indigenous community gets? Is it going to be population size? Is it going to be the severity of the spread? Is it going to be even perhaps, how many people elderly people are in that region? What are we thinking about? Where's your head at this point?
Thank you very much.
And we are going to leave Ottawa and take you now live to Toronto. Here is the Premier, Doug Ford.
Logistical undertaking, the likes of which this province has never seen. Because as soon as these vaccines are available, we have to be ready. We need military precision. And General Hillier, he will bring the same expertise, the same disciplined leadership to this mission as he has to every other national and global engagement